Hello, good morning. Hope everyone can hear me.
Yes, we can.
Yes.
All right, welcome to day 5 of the African Studies Group 2021 International Conference on Practitioner Panel Community Engagement. My name is Jean-Pierre. I am a student at the School of Physics here at Melbourne Uni. But first of all, I would like to acknowledge the country on behalf of the ASG. I would like to begin today by acknowledging the traditional custodians of the land on which ASG operates and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. So, well, I believe everyone here is very happy to see how the conference has gone so far from Monday today. And of course, excited to see what the final day has in the basket for us. So, so as we start the first session, I would like to sort of welcome Gerald, Dr. Gerald Onsando. First of all, I'm gonna sort of introduce him. Gerald is a research fellow at the School of Social and Political Sciences and the Melbourne Social Equity Institute. He's an experienced cross-cultural research and program evaluator on immigrants' education, employment, social justice, and community social cohesion. Gerald is going to be leading the first session of the program today. Over to you, Gerald.
All right. Thank you very much, JP, and good to see you again. I would also like to begin by acknowledging the traditional owners of the country on which we all virtually meet and pay my respects to their elders, both past and present. I think before we start, it's just good to have a few ground rules. So welcome everybody. It's good to see you all. So this is the Practitioner Panel 3 on community engagement. It looks like the speakers will be talking about community aspects of the African philosophy of Ubuntu, which is really exciting to me. We have 3 amazing speakers on this panel. We have Patience, we have Selba, and we have Mamadou. I hope Mamadou has joined us. I think I'm really privileged to be currently actually working with all the 3 of them in one of the Ubuntu projects we are doing. Now, each speaker will speak for 15 minutes. We will have questions and comments from the audience after the last speaker has presented. However, while presentations are going on, the audience is requested to mute their mics, or Claire, I think Claire can do that, and can use the chat function to post questions, which will be considered later. And then when we finish, I think if speaker or if the audience wants to ask a few questions, you can just raise your hand using the function there. Pretty much that's about it. Again, thank you very much and welcome to everybody. I will now go ahead and introduce the first speaker. So the first speaker is called Patience Onuogu. Patience is a research assistant with the University of Melbourne. She received her Master of Public Health from the University of Melbourne through the Australia Awards Africa Scholarship Program. Before coming to Australia, Patience received her bachelor's degree in Health Information Management from Hudegbe. I hope I've got that one correct, Patience. Hudegbe, yes. North American University, Benin Republic, and has worked in some of the hospitals in Nigeria. Patience has participated and presented conference papers both in Nigeria and at the international level. She is an active member of the Public Health Association of Australia, PHAA, and Health Information Managers Association of Australia, HIMAA. Patient's topic is evaluation of the Ubuntu Empowering African Australian Mothers project. So Patience, you've got 15 minutes. Welcome.
Thank you, Gerald.
Hey, Patience, as you prepare, can I mention when you're just about to finish, when you got 3 minutes to go, I got this from Diana. Thank you, Diana, for this. I'll do this 3 minutes warning, and then when your 15 minutes are over, I'll show you the red one. Hopefully it will scare you to stop. That's it. Thanks, Patience.
Okay, I'll start by acknowledging the traditional owners of the land in which I live and work. I pay my respect to the past, present, and emerging leaders. I also want to acknowledge my wonderful team, Kofi, Dr. Gerald, and Dr. Diana, for the opportunity given to me to present our preliminary findings of the work that we've been engaged with over the few months, which is on evaluation of Ubuntu Empowering African Mothers projects. And these are my outline, which is background / role of a mother, resettlement challenges of African Australian mothers, partnership / introduction of Ubuntu Empowering Mothers projects, the African philosophy of Ubuntu, our task, where we are at the moment, then my conclusion. I'll start by saying that in many African communities, mothers play numerous role and also an important role, which consists of caring, advising, guiding, and also supporting their family as well as the young members of the family. So now, due to resettlement challenges, the African Australian mothers, they find themselves, unable to offer the support, especially to the young family members who are at the risk of offending and as well as reoffending. So, and these challenges include unresolved trauma, following even after settling in Australia, unhealthy families, which consist of disputes between kids and their parents, lack of knowledge of the available services, and even those that even have this knowledge, they still find it difficult to access these services, language barrier and cultural shock, racism and discrimination, issues of unemployment, suicide attempts, and height of it, which is overrepresentation of African Australians in prison. So now to address this issue, the Department of Justice, in partnership with two grassroots organizations, Department of Justice with two grassroots organizations, which is Afri-Aus and AAFRO, they came together to implement the Ubuntu Empowering African Mothers project. Why the role of the University of Melbourne is to evaluate the implementational fidelity of these projects. So right now, I'll be talking about the evaluation aspects, while Selba will be talking about the practice aspect of the project. So now, the Ubuntu Empowering African Mothers project is a 6-month intervention, which aims to empower 30 mothers. That is 15 from AAFRO and 15 from Selba's organization. So using the concept of African philosophy of Ubuntu, and the second aim of this project is to develop and document a set of Ubuntu practice guidelines, which will help the service providers to work with families, community members, and also the young African Australian members. So now the short-term outcome of this project is to improve the health and well-being of this mother, also improve their family connectedness, as well as increase their capacity to support their children. So now achieving these three goals will ultimately lead to, we ultimately lead to these mothers being empowered to, support their children who are at the risk of offending and also re-offending in Australia. So now I'll talk a little bit of African philosophy of Ubuntu. This philosophy is a common philosophy, that seeks to promote the practice of community, against the idea of individualism, Its major emphasis is on, it is not about you, it is not about me, it is about how we can work together, to achieve a common goal. It also seeks to promote, the idea of, it also seeks to promote humanity of self against the, through the humanity of others. Like, you can't be human by yourself, you can't do, there's some extent at which you can operate, and there's a level at which you can do nothing. You need others. And it is often described by a maxim that said, I am because we are, So this idea of collectivism, against individualism. And the essence of empowering this mother using this concept of Ubuntu is to, enable them to, support their family members using a cultural responsive approach. So now, just like I mentioned earlier, I said that, our task is to assess the operational effectiveness of these projects. So in doing that, our methodology is the use of realist evaluation, which is a theory-driven approach, that seeks to, that seeks to discover why a particular program will achieve a result, in one setting, and this same project will achieve, a different outcome in another setting. So now, a realist evaluation often focus on, what has worked and in what circumstances has it worked. It also is not only look at the impact and intervention is able to achieve. It also looked at the underlying causal changes, of a given project. And what realist evaluators do in advance is to look at what are the mechanisms in which a project, is to operate, and also looking at the context and also the expected outcome of that project. So now, in our own context, in the context of this project, the intervention is Ubuntu Empowering African Mothers Project, and the context is looking at the issue of social and justice situation, which is concerned, about the issue of family and community disconnection, as well as how to improve the mental health and well-being of these mothers. Then the mechanism, is how to empower these mothers using the African philosophy of Ubuntu, and ensuring that this is applied in intake assessments, and also in while delivering the group activities, to the mothers, as well as making referrals. So the outcome that we anticipate, as I said earlier, is to improve that the mothers' well-being, improve their capacity to support their children, whom are at the risk of offending and reoffending. And in using this concept, we just seek to understand what has worked, how has it worked, when has it worked, and if this same concept, can work elsewhere. And this is what the Department of Justice is keen, they're just keen to know how this concept, will help, and what are the underlying causal changes. So at the moment, this is where we are. We are at the stage of data collection, and in our data collection, we are using one-on-one interview, and our rationale is to engage with these mothers to know what is changing using the concept of Ubuntu philosophy. And we also use observation, just like trying to see what are these women, just trying to see the activities that these women are engaged with, and how they are also engaging with it. Like this is one of the group activity at Selba's place, and where I just sneaked in to see what is going on there. Then we also deployed document review as a methodology, where we look through the weekly reports that AAFRO and Afri-Aus, on a weekly basis, they submit report to us, and we sit back to look at the kind of activities that they are engaging the mothers with. And we also use focus group interview, and this is one of the sections at our server's place. You can see Kofi and I, that's diligently paying attention to what the mothers are saying. So far we have done our first focus group interview, and the second focus group interview is scheduled for next week, but due to the lockdown, so I guess we are going to push it further. So now, alongside data collection, we are at the same time brainstorming, trying to put our heads together to come up with evidence-based Ubuntu guideline. So 3 weeks ago we had an all-day Ubuntu development day with Selba and Afri-Aus Care and Afro, and the members of the Department of Justice. So we came up with this theme: safety, connectedness, storytelling, healing, empowerment, circle, collaboration and solidarity, you know. So from this team, we try to look at what are the practice, you know, practice principles that we can derive from this, as well as we also looked at, you know, measuring, you know, what a success would look like using the concept of Ubuntu philosophy. So this is where we are at the moment. This is what we have been engaged with over the few months. So the Department of Justice, they are eager and they are waiting to receive a report. So we are looking forward to submitting a complete report of this project to the department by October, and as well as disseminate the findings through other available means. So I want to say thank you for listening, and we are happy to take your questions.
Thank you very much, Patience. I think you can stop sharing now.
Okay.
So, I think we kind of agreed with the organizers. We might have just one, and Claire is monitoring the chat. So if you've got any comments or questions, you can put them in there. So is there any interesting thing at the chat, Claire? Or are we able to go straight to the next presenter?
I think we'll move on to Selba and come back for discussion at the end.
All right, thanks. Thanks, Claire. So as Claire has just ordered, we move to Selba. So yeah, once again, Patience, thank you very much. And I think I'm very privileged to be part of that project. And you're going to hear more practical aspects of the project from Selba. And I'm sure Mamadou right at the end will add something onto that. So as we said, the next presenter is Selba Gondonza Luka. So Selba, I think otherwise known as Mama Ubuntu, is a Chief Executive Officer of Afri-Aus Care, a mental health clinician, and a sought-after speaker and community leader. Selba is passionate about supporting young people and their families as they adapt to Australian society. She is the founder and CEO of Afri-Aus Care, a non-for-profit organization which provides support services to African Australian youth and youth from other diverse backgrounds and their families. She's also the co-founder of the successful Black Rhinos Basketball, a crime prevention and intervention program for at-risk young people. Selba's topic is Ubuntu in Community Interventions, the Ubuntu Empowering African Australian Mothers Project, and other Afri-Aus Care projects. Welcome, Selba. You've got 15 minutes.
Thank you so much, Dr. Gerald, and also the organizers of the conference. I will actually fly because I've got a lot to cover. So I've named actually my presentation, Restoration of Ubuntu and the Positive Change Model. So it will explain itself as we go through the presentation. And on the photograph here, you can see the Minister of Crime Prevention, Minister of Justice, Natalie Hutchison. When she came, Honorable Natalie Hutchison, when she came to launch the Ubuntu Mothers Group. And on the left is my daughter, who we used to fight a lot when we were fighting in the family as a part of intergenerational conflict. So I would firstly would like to acknowledge the traditional owners of the land which we meet today on Zoom, the Wurundjeri people of the Kulin Nation, and pay respect to the elders, both past, present, their descendants, and kin as the custodians of this land. Little bit of introduction. Afri-Aus Care was founded in 2015 on a kitchen table when I was fighting with my daughter. It's a long story. But who are we now? We have become a group of professionals. We provide health and well-being support services to African youth at risk and their families. We also use the concept of Ubuntu and the positive change model. Why positive change model? You can actually say, yes, I am because we are, collectivism. Where 2 or 3 people are together, you always fight. Unless if you forgive each other, Ubuntu won't work. So at Afri-Aus Care, we mainly use the positive change model so that the Ubuntu can work so well. I always acknowledge ADRA because they are the ones who have been assisting us with finances and governance when we didn't have funding. And also Springville Spanish Adventist Church, they have given us a 4-bedroom house, which we have turned into an African village, African home, where Ubuntu definitely is practiced. I want to talk to you a little bit about the journey of African people from that motherland, 54 countries. We practice Ubuntu, whether you are in a village, you are in a camp, a refugee camp, or we are in a town, you help each other. That Ubuntu, we give each other food. But something has attracted us to this beautiful land of Australia. So we came here through different pathways. Then we meet resettlement challenges, which patients touched, but I'll go through very quickly. So these resettlement challenges are unresolved trauma from country of origin, the refugees after resettling in Australia, marriage breakup, you can't find a good job, language barrier, dysfunctional family. Myself, I had a beautiful husband, but he left for another woman in Africa. Why? There are so many issues. You know, you have read a lot about it. I don't have to go in details. Barrier to access services, racism, school dropouts, unemployment, underemployment, substance misuse. A lot of young people are actually dying and also getting into jails because of substance misuse, and overrepresentation of African Australians in prisons. And this is the reason why the Department of Justice approached Afri-Aus Care to do this project together with AAFRO and also the University of Melbourne. Suicide attempts and complete. I can't tell you, 2018, we buried nearly 13 African people to suicide. It was heartbreaking because I used to go to each and every funeral. So sorry, crazy. I said I'm going to fly. So after seeing all these challenges, what has Afri-Aus Care done? We want to help the African people to feel the sense of belonging, to feel that Ubuntu. So we offer culturally appropriate interventions. Through this, we are training our young people. Afri-Aus Care face its young people, African, Asian, across the globe. These are the young people who are helping the African women so that they can understand what Ubuntu is. We are reminding ourselves about Ubuntu, but we have to work with other people who are not Africans so that they can understand, so the integration and the belonging will work well. Afri-Aus Care today, the workers who are top, they are all youth. I am the only dinosaur and also the business manager, but all the people who are working are young people. Okay, crime statistics. I got this from Dr. Gerald. In 2007, it was about 80. 2018, 400. Now, I don't even know. It must be many, many people in prison. When Corona is over, I think I would like to start my prison trips again. And also about South Sudanese people. When you hear about an African people, South Sudanese committing crime, it's everywhere. But look, the percentage, 1%, Australian, 70%. So when you are judging these young people, I always say, look at the reasons. What are the reasons these young people are found in prisons? So the minister was looking for this type of answer. So this is what she had to say. Honorable Natalie Hudson.
Victoria's African Australian community is a very resilient community and has already contributed so much to our culture here in Victoria. But as Minister for Crime Prevention, I know that African Australian kids are overrepresented in our youth justice system. In order to address this, we are launching a range of crime prevention programs. But one of those is the newly launched Ubuntu project, which is about empowering African mums in areas where we know need targeting. And we've put this program together with African community leaders to deliver it in place-based settings to ensure that we are giving the best future possible for those that are most vulnerable in coming into contact with the justice system. We know that isolation and disconnection can be major contributing factors to why young people get involved in crime. And we want to make sure that we're overcoming that and getting to the root causes of crime and wrapping around these communities.
I sincerely thank Honorable Natalie Hudson for trusting two grassroots organizations to do this Ubuntu project, because we need it. The Australians need to know what the mothers are going through. So you can see here, through our project, we started in January, alternative education pathway. This is what patients covered before. We do have lots and lots of stakeholders who come here to see the mamas, MPs from Canberra, ministers, they just show up to see what is happening. So the message is actually going out. You can see here, Julian Hill, federal member for Bruce. He came when the minister was launching the project. You can see the mayor, some of you know Vivian, the chairperson for Victoria Multicultural Commission. I showed you this before, and just look at this Ubuntu patients. The photograph, the picture that you showed before, look, it's happening here, and it's the women actually here in Springvale. So whatever we are saying, we are talking to these women, it's actually happening. Look, we have a garden there. We get food from the garden. We cultivate the vegetables, we cook, we eat. And we also have an embedded lawyer. The lawyer comes to hear the issues about what the women are facing, but we also take the women to see the GP so that at least mental health they are assessed, and we also have been assisting them with employment. The department wanted us to work with 15 women. Guess what? We have registered 60. More than 30 they are working, and we continue to get more women into employment. They are now asking for us to start another group on Saturday because Thursday it's not enough. In our kitchen, we actually cook corn, from the garden. This is just so beautiful. Food from the African shops is being saved here. This is a little bit of a video. The women, just watch a little bit. It makes me happy. Look. Okay, because I don't want to run short of time. Now, the positive outcomes of the project. This is very important. The department wanted us to work with 15 women. As I've said, we have registered 60, over 30 they are working. What activities attract the women? When we were doing the grant, I did speak to the people from the Department of Justice, and also when we were talking to the minister, that in order for us to work with the women properly, we need to give them incentives. So we give them incentives in petrol because they have to travel all Southeast to come here. And also we provide food every Thursday and they cook the food. We buy from African shops. We also have done employment, as I've said. We do focus group. During the pandemic, when we were closed, we were doing online and we continue to do online. Right now, we are preparing for vaccine sections online with the women. Excursion, I've taken these women to a hotel in the city. Shortly, we are going to a big, massive Rotary meeting 200 white people, these women will be dancing there. If we didn't have this project, these women would have been sitting in the home, getting depressed, getting kids upset, and getting into jails. This is the positive way of crime prevention, by empowering a woman. Legal support, mamas who are refusing to go to court with their children, they are going, and when the kids come out, they don't reoffend. A few, they go back, but not many. About empowering, we have also employed 2 mothers here through this project, and also employ their children as well. And it's just getting on so beautiful. I will encourage you to go on Google and Google what we are doing, because a lot has been done through this project. I cannot be able to present in 15 minutes. So the mamas, as the patient said, when we were doing the co-design project with the Department of Justice, we took 3 mothers, they participated, they did speak from their hearts, and guess what? They have been receiving phone calls from the department as well. And women leadership, we have chosen 3 women, very powerful women. They were depressed when I first met them, but they are spokeswomen. We are now being invited to other places so that we can talk about this project. And what? I have recently been approached by young mothers. They said, you know what, Mama, we can join your group, but you guys are dinosaurs. We want to speak about our own issues. So we have now formed a new group of young mothers. I'm yet to speak to the minister, maybe in a short while, that you know what, this program should not die. Instead, we must replicate. We can actually see that the mamas are so happy, and I can't tell you, I am a mother, I have seen it, but when you empower a woman can change the world. Now at last, because I've got a few minutes, how many minutes do I have? 3 minutes, beautiful. Most of you who are listening, you don't know who Selba is. I was a cartographer in my country, second lady cartographer, came here, I was reduced to 0, domestic violence. I don't blame my husband at all. He ran away, he married a younger woman in my country, but resettlement challenges. I had a baby, she passed away. Because she passed away because she was born a prem. From there, with my depression, when my daughter passed away, I was in a psychiatric ward for 6 weeks. It was at the psychiatric ward where I say I got my doctorate. I'm not a doctor, but my own, I gave myself that doctorate of understanding the human mind. And that's why we opened Afri-Aus Care. So through that, I went to university, this beautiful university, Melbourne University. I studied clinical mental health. So I'm a mental health clinician. Then I find it easy to speak to the women who are depressed. Most of the women, they say, you know what? We can't control our children because our brain is not working. Through Ubuntu, because in men's service, I cannot talk about to the group that I had mental illness. They will fire me. But through the Ubuntu, what we are doing now, it's about storytelling. I am because we are. We see another person in another person. So as a group, we have been talking about our issues. The women have been open. I've been telling them how I worked with my daughter. They are doing the same with their children. You know what? That's why our group is non-stop. It's growing every time. In Africa, I would say it's like you are putting petrol in a bush. It will just go whoop. That's how things are happening. So don't get scared to talk about your story. If you are not comfortable, don't. But I have seen through my storytelling, I have been able to help a lot of people. And if people want to know more, contact Dr. Gerald, contact Dr. Diana. These people, we have been working so well together. Dr. Diana is actually Australian, but I tell you what, she's an Ubuntu guru. She's an African already. Why? She has been coming and also talking to us and talking to the women. They know very well what Ubuntu is. So whosoever is listening today, Ubuntu has come to Australia. It must stay here because African people, we are not going anywhere. We are here and we want to work very well as a sense of belonging is being found through Ubuntu. Thank you so much.
Thank you very much, Selba. That was really awesome. The passion has really come through. I like what you said. Africans, we are here. We are not going anywhere. And I've had the opportunity of visiting Selba's place at Springvale. So Selba, probably whether, I don't know if you permit me, but everybody is often invited to visit Selba anytime. Lots of food. I usually go there because of the food and other things, but awesome, Selba. Thank you very much. I'm sure there's going to be a few questions after the next presenter. Thanks. Okay, the next presenter is another Ubuntu gentleman. I call Mamadou Diamanka. I hope I've pronounced that well, Mamadou. Mamadou is also part of our team in this Ubuntu Women's Project. So Mamadou is doing a project in the Western suburbs. Probably Mamadou might mention something about that, but I'm sure Mamadou is having another topic here. So Mamadou Diamanka is the founder, CEO, and managing director of the Australian African Foundation Retention and Opportunity. We normally say AAFRO Limited. It is a non-for-profit registered charity organization. I think Mamadou didn't have so much in his bio, but I know Mamadou, he's got so much to say and he's done so much in the community. His topic today is peace and coexistence through AAFRO Ubuntu restoration practice. Hey, Mamadou, you've got 15 minutes. Welcome.
Thank you. Thank you so much, Dr. Gerald, for the beautiful introduction. First of all, before I start my topic, I would like to acknowledge the traditional landowner where I am sitting and then delivering this conversation via Zoom. Pay my respect, the past and present in emerging communities. My name is Mamadou Diamanka. I am the founder and managing director the Australian African Foundation for Retention and Opportunities. I don't expect you to memorize this, by the way. So at AAFRO, today I will be talking about coexisting through Ubuntu-Restorative practice. First of all, I want to touch base on a little bit about myself to give you the concepts why AAFRO exists and why I do what I do. Because I do believe that with the current generational technology and development, there's no doubt that some of you already have jumped in or jump onto Zoom or Google, start Googling who is this AAFRO and all of that. I do like to apologize that we are still under construction with our website, Facebook, LinkedIn page, whatever you could imagine of the organization advertise themselves. Yes, if you go to Google, you won't see much, but if you go to the community, you will get told a lot about us, what we do, especially in the Western suburb and also around the Department of Justice youth custodial facilities. So my own little personal story linking to AAFRO. So I'm just checking to make sure this starts. So at the age of 8, I was taken from my village to the capital city of Dakar. So what that means is mom and dad were so desperate their children need to learn how to read and write because something they're never able to do in their lifetime. At the age of 8, a young boy playing under the trees with his friends, all of a sudden being called, hey, come, your parents are calling you, like every kids. I remember it was actually around this time, like early morning. I thought some people were very excited. Hey, sweetie, you're going to Dakar, doing what? Oh, Dakar, yeah, I heard about it. Oh, you gotta go there to learn how to read and write. And that's it, and they never return until they wanna become a big boy. So as you can see, there is the little kids in that photos. That's how I used to like my lifetime in the capital city of Dakar. What talibis mean is, Talibe is another word, kind of like really linked with the Arabic, with the talib, which is someone really asking or learning. So, but other young boy, so we ended up there looking after ourselves, meaning that you have to wake up early morning to go get some food, And then the midday, you go back some food like lunch, dinner, you go back some dinner as well, including clothing or everything, whatever you can really get to survive. We look after one another. But during this time, what we used to also come across with that, a lot of people who are really care, who really like to spend time with us to ask us, who are you? Which is actually today keeping me where I am, still linked with my own siblings, but also the wider community where I originated from. So where some of them really share their story and tell, hey, look, I used to be just like you. I said, oh, really? Me with this boy? And some of them sometimes say, look, I can see you will become something else one day. And we just never understand what they're talking about. Other kids with the 45-degree with no shoes. So it's too hard to take in this kind of stories. And how this link into the coexisting Ubuntu-Restorative here in Australia, but also the Australian African Foundation for Retention and Opportunities, which is AAFRO. So,
hey, Mamadou, can
yes?
I disturb you for a second? I'm
Yeah,
sorry.
sure.
Are you able to press the play button so that the presentation fills the screen?
The play button, you know my tech, Gerald.
Oh no, I know you're awesome in tech, Mamadou.
You know
so
that.
If you can do that.
The play button. Okay.
And then we just want the slide to fill the screen.
Can you see?
If not, that's okay.
It's playing now?
Slideshow. It's slideshow. The button slideshow.
Sure.
Mamadou, slideshow.
All right. Slideshow.
That one, yes.
This one?
The one that I just said. Yeah, there you go.
Here we go.
Yeah.
It's working now?
I've added a few minutes, Mamadou. Okay, continue.
No, that's okay. It's working now?
No. Press slideshow at the top, Mamadou.
Okay.
Top. Yep, the top up there. Yep.
This one?
No, left, no, down and right.
Yes.
Down. Oh, yep, there. If you go, you're right. Slideshow.
This one?
Right. No,
Next.
down, right. Right. Keep going along.
Right.
Turn right. So they keep going along.
Oh, yeah, hang on. Oh.
Slideshow.
Okay, slide.
Just read.
Good. That one.
That one.
That starts in the beginning.
That one.
Yeah.
That one.
Yeah, I pressed it. Is it working?
Yeah.
Just press, click again.
Okay, click again. Yeah, working?
Yep.
Yes.
Yep. Good.
Yeah, oh, beautiful. Because some of the photos need to be a little bit, you know. Oh, thanks so much for that pause. Okay, so it's led me to the Australian African Foundation for Retention Opportunities. When we landed to Australia, they still some other difficulties I have faced myself. First of all, sorry guys, I a little bit change here. Okay, here we go. Yeah, so what happened then at the time, my end that I'm qualified, but some of the qualification I got maybe was not really recognized. And also the starting to get a chance to find a job was very hard on my end. So someone have to give me a chance. So what this chance was is to someone who can give me a chance to be employable. The people who gave me that chance, first of all, in the community service was the Alfred Hospital, where they've been looking at someone from the bilingual cultural support, who can go there and work with the people who come from the cultural background, but they have no one who can assist them. So after having that chance, what this gave me then the entry level within the community services sector. So what this means, the community services sector, youth services are the called cultural linguistic diversity worker within the Western suburb, give me the strong access to the wider communities to understand some of their needs, where some of them used to come and ask me some advice, which I have no idea, which is myself, actually I need the same advice I was really asking. So then I noticed, sorry, I just have to skip a few. Yes, then oh, not that one. Gerald. So, okay.
Go back to the, yeah.
Okay, sorry. Sorry, team, I have a system here. So, okay. So through that time, I learned that there's a big gap for the young Africans themselves in general, but not only that, but also the parents themselves. So I felt that I got the responsibilities as a migrant and also someone who really struggling to act on something in partnership with the elders. So the partnership is really to create a tutorial educational program that is targeted young people from the age of prep to year 12, which will give them a sense of belonging, but the sense of start, but as well also to able to integrate, so where they can when we all feel Australians. So this was created back in 2011. So after exists 2011 to deliver this program. And how this worked, we ended up, okay, so while we're doing this program, so we felt that there is the need of the independent living skills. Sorry, I just have to go this way. The independent living skills program was to create a study program that will allow the young Africans to learn how to look after themselves. As most of us agree that Africans, families, mostly the mothers, are normally take care of the food, everyday living, feeding, breakfast, lunch, and dinner, but also sometimes washing the clothes. So I recognize that's going to be the problem of the young African to integrate within Australian societies, because this is still the same service the African mothers offer younger people. Back in Africa, they still offer the same service. For me, they were the risky that the young people maybe will be struggle to look after themselves. So we created the independent living skills program that to teach young Africans how to do budgeting, which means also how to manage their financial income, at the same time, how to look after themselves, not to be too dependent on their parents. So this model reduced the pressure of mental barriers, but also some of really the isolation their parents maybe will be continue to feeling, where they no longer going to feel that they have to be responsible to feed everyone. So this therapeutic program, we was attracted by the World News Australia, SBS, which is broadcasted alongside with our tutorial program. So we delivered this program inside in custodial youth justice setting as well, possibly here in Melbourne. And then we come across that there is a need for the Afro in school. This is a real program actually. So the person sitting there, he's one of the Afro staff member, currently is the general manager of youth and programs. So the Afro in schools is designed to unpack some of many of the young people are facing at school, such as bullying, harassment, lack of cultural identities. When we put this program together, actually the aims was to have the session between 6 to 8 young people, but we ended up actually receiving 14 to 17, which is double up the session. So the importance of really connecting with the cultural identity, for us, it will give you the sense, understanding more who you are, and give you the chance to build some comfortabilities about the people around you, or just about yourself as a person. Okay, so then while we do this, we come up with the Afro circle. So this is, by the way, I just decided to put this photo there because most of our program we work with young people are super high risk. So therefore, I'm trying to avoid not really to put identical images, but this is just give you the example of what Afro circle is about. So it can be operated with the young people who are incarcerated, also young people who are at risk to get in contact with the justice system, through to group session, to cultural identity as well, but also providing mentoring, one-on-one support, referral, but also create a safe environment that young people can empower one to another. But not only that, the Afro Circle also create a platform channel that partnership organization should be able to work together while they support one particular person to reach their potential. Sorry, not that one again. There, what happened? Okay. So we come in now to the current how to call it, the Ubuntu project, the Empowering Mothers, Afro Women's Word. So Afro Women's World was also created out of the two federal programs. So the program had existed since 2012. And the Women's World's aim to provide a safe environment that isolated women will be able to come and meet one to another, share some of their stories, support one to another, providing a referral process, as well also bringing someone who will be able to answer some of the questions that Afro would not be able to answer, and then connect it with the other services. So they will be able to come over some of the barriers they are facing, as well to be part of our society, to be part of, again, to the coexistence. So this is the Afro models. So these models today are really well received to the communities. We've been doing this one quite some time, and we are confident that the work we are doing are very making so much difference through to based on the people who are coming into this program, but also the people who we are partnering with. Sorry, this is it. Any question?
Oh, thank you. Thank you very much, Mamadou. You done, yep?
That's it. I'm so sorry. So the technology side of this really the big.
No. That's okay, Mamadou.
Yeah.
Thank you very much. Amazing work. Quite a number of programs there you're doing, and I'm sure there's going to be a few comments and questions after this. So now, Mamadou, if you can stop sharing, please. Awesome. All right. So thank you very much. That was it. Thanks to Patience who started the conversation. Thanks to Selba with your passion, and Mamadou for your amazing work. I'm sure there's quite a number of questions. Probably, maybe if you can, we'll just go straight to the questions, and I think because time is running out, we can use the, if you have a question, just raise your hand. Tell us your name, tell us whom the question is directed to, and then for the ones who are answering, Patience, Mamadou, and Selba, if you try just to be very short in response. So, okay.
Sorry, I don't know what is happening with my video. It says I cannot start my video because the host has stopped it. I don't know.
Okay, I think Claire will take care of that.
Yeah, thank you.
Yeah, so I can see Vincent is ready to go with a question.
Yeah, thank you, Gerald. Thank you, Patience, Selba, and Mamadou for those interesting presentations. I like the zeal, the concept of Ubuntu, and the impact it is making. But my question goes to Selba. Selba, I would just like to know, how do you identify those women? And I know there are a lot of women going through similar challenges and issues. So how do you pick up on those ones, those you're working with?
Okay. So our work we started in 2015. My focus was youth at risk. So we started basketball, but also supporting the young people at court. It was at the peak of the Apex gang, when young people were going to court by themselves. So I started supporting them and asking the young people who didn't have their parents, it's like, can I please speak to your mom? So I started getting deeper and deeper into the African communities that we work with. So then through the Ubuntu concept of storytelling, I could tell the moms, because most of the moms, when kids were doing that, it's like, I don't want this child to come to my house because this will cause more issues. So through the concept of Ubuntu of storytelling, I will tell them about my story, marriage breakup, psychiatric stories, and the women would say, this is exactly what I'm going through, but I can't talk about it. And then we invited them to a group then in Dandenong. So we used to meet in Dandenong before we moved to Springvale. So it's about storytelling, being myself, not ashamed of what I have gone through or what my daughter has gone through. And that's why people are just opening up. Now it's even so scary with COVID because women still want to come. Yesterday, it's like, can I come? I said, no, listen to the TV, you can't come. So that's how we get them. But also, it's the way we treat them. We also have, I tell you, food at the center, the garden. We also offer psychology support, but also referring them to appropriate agencies. Like we have Dr. White. If someone has depressive symptoms, I explain, I went through the same, see the GP, psychology, and things like that. It's just being me and let the women be them so that they can find their sense of belonging in Australia. Have I answered your question?
Yes, please. Thank you.
Okay, thanks, Selba, thanks, Vincent. Mamadou, if you're still listening, there's a message which has come through. Good to hear about the programs. Keep up the great work. Change makers, inspiring others, the power of storytelling, which is what Selba also mentioned. I can see if, I don't know if Claire, you can see if there's questions. I'm not sure if I can see anybody raising their hand.
Thanks, Tess. Could you please unlock my video, Claire?
While Claire is doing that, I think, Kennedy, you have something to say?
Yes, I had a question to either of the presenters. It's very interesting presentations, and it was really interesting seeing how the concept of Ubuntu has been applied in this context. So reflecting on the various kinds of projects that you're engaging in and using Ubuntu as that framework, have you had to adapt the concept of Ubuntu from the African to the Australian context? And if so, would you perhaps share what have you changed in applying that concept?
Can I just ask, African Australian context, meaning the way we are now adapting to Australia?
Yes, because Ubuntu, as you mentioned, was traditionally practiced in Africa, but you're applying it here in Australia.
I'll go first. So we still use the Ubuntu philosophy, yeah, of I am because we are. And that's why here we have got a house. It's like a village. So we remind the people that, yes, of course, it's individualism. If you are living in Pakenham, you are just in Pakenham there, you can't go next door to ask for anything else. We teach the women that you can reach out to people if they can accept you. But more so, the most important thing is understanding our children who have got rights. So if a child says, I've got the right to do this, don't fight them. Instead, cook food, talk, discuss with them, making them your friends. So we are assisting these women that we cannot change the Australian laws. They can change with time. When you're in Rome, do as Romans do. That's how we teach them. So they are not more so depressed that the children are not listening. So we don't only end with the women. We also have groups for young people, how they can understand us, the dinosaurs, the way we think. So we think that working with both groups and understanding what Australia is making things very, very, very easy. But we also work with the lawmakers, like the police, so that we can understand what it means to run away when police is stopping you. So we try to reach out to stakeholders that can come to come to meet the women so that they can understand what it is to be an African in Australia. It's happening. Have I answered your question? Thank you.
Thanks, Selba. And Mamadou, maybe you can answer the same question in terms of, as you said, Ubuntu as an African concept, and you show the pictures in Africa and how that one is used here in Australia. But before that, if you wanted to respond to Tess and say something?
Yeah, no, I guess Tess, okay, keep up the good work. I think Tess, I want to thank her. Yeah, so I will continue the great work, Tess. Thank you very much. In terms of really the concept of Ubuntu on the third really in practice in Australia, for just to simplify, so for Afro, in 2015, so I had opportunities to study about restorative justice. So, which is led me to going to overseas, to complete a group community conferencing, but as well went all the way back to Africa to meet with the elders and the local people. And also looking at 3 different key areas. Part of the focus was what is the community group community? What is community conferencing and the restorative justice? What is the issues are young African often facing? And could community conferencing and the restorative justice to be introduced into African communities? To bring that to the current Ubuntu we do, so we come up with a simple assessment model, which we still building on that, which really follow the African way of doing things traditionally, to be able to capture the stories of many of Africans that sometimes get missed within the system or within the other approach. So that's traditional approach, giving us very strong understanding some of the need, which is lead us as an organization also where best really to refer to the participants in general. So I hope, Kennedy, this add a little bit into your questions.
Thanks, Mamadou. There is a comment, I think it's a question on the chat. So Lorna, thank you for sharing explanations of these useful grassroots programs. So, thank you to Selba and Mamadou. My question is how to duplicate these in regional Victoria and hear your thoughts about how best to do this. Selba, as usual, you're already there. Yes. Go for it.
So 3 weeks ago before Corona, we actually went to Geelong. So I did the similar presentation, but in church. So they were very, very impressed. They actually gave another organization we work with a grant so that maybe we could apply. I couldn't stop. People were just, please come here, come here. So what we are doing is being heard, but it's also us to present. And regional Victoria, there are grants in regional Victoria, I would say we can easily reach. Please come, we can come and teach them. The women, our 3 women, the spokeswomen, they speak in the South Sudanese language. So we have actually trained them to speak in their own language. To conclude it, I would say I'll be speaking with the department that there is actually a great need, even in country Victoria. How can the department help ourselves and Mamadou so that we can replicate what we are doing? We are so happy to help people because what has been happening in the African community has been really hard, especially the women. I'll tell you one comment that I had 2 days ago. A family of 9 were homeless. I finished work 10 o'clock, making sure that they were put in an apartment. The younger woman came to me in tears. If you were not there, it means we would have slept in the car. I said, no, it won't happen. It hasn't happened. Her comment was, I've got these children. If I'm not thinking well, how am I going to discipline my children? This is why we wanted the Department of Justice to assist us to empower a woman. Because the women we have now here at Afri-Aus Care, they are able to look after their children, and that woman needs to learn. So country Victoria, we are ready. Mamadou, are you ready? For me, I'm ready.
Thank you.
Oh, Mamadou, there's the challenge for you.
Thanks, yeah. I'd like to add that a little bit here. Of course, we are always ready. So especially for Afro, we're very lucky enough that our programs, we have test them over and over. So pretty much like we don't need really a longer preparation. We already got what we need. So we delivered a significant crime prevention programs, like I mentioned before, including inside youth justice custodial, just most recent. Last week, my teammate and I, and Afro General Manager, Mr. Fury, we went to actually Shepparton. So I said, hey, look, we need to go and drive to the countryside to have a see what's happening out of there. If we're doing these programs in in Melbourne here, we need to also go check it out because we are a community. We don't wait until people, when they reach us, we can go and reach them too, to let them know this is what we do. We are here, this is what we can contribute. And from there, we will let them come. That's Ubuntu. You don't wait people come to say, when you see issues back in Africa, in our culture, you don't wait people to come tell you, hey, come fix I'm having a fight with my friend, or me and my brother or my wife. Neighborhoods, usually they come there, knock the door, ask, hey neighbors, we heard there is something going on here. Can we help? What's going on? So we utilize the similar approach. We went to Shepparton, where we met with one of the organizations there, the African House. It was really us opening, just in the beautiful place. And we are ready. So if the region of Victoria wanted that, we are ready. If the national Australian country ready for that, we are ready. So we are not really people who are just starting on this. As I said again, yes, when you go to Google, you don't see Afro much. But in the term of really practice, if there is something we can contribute, yes, we can contribute in partnership.
Thanks, Mamadou. Always ready.
Yeah.
Charlene, you've got a question.
Hi, everyone. Just a very quick question. So all of you are working with Gerald and Diana, and they're obviously very good at community engagement. Do you have any advice for how other researchers could engage well with communities?
Advice?
Go ahead. It's by coming and being part of the community. I wish you were there when the department came, when we were doing this co-design. The way the women were talking, they were on fire. It's like one of them, when I first met them, couldn't speak good English, but through the English classes we have, she was able to express herself. So they have to have, maybe asking for more money when they're doing the research, for the researchers to come on the ground. Not just the patients, you come in 3 hours. Yeah, of course you do great work, but be there the whole maybe 5 6 hours. And sometimes if there are community things happening outside the centers, go and be there as well. And another thing where the researchers can work well, they need to look for more collaboration with other organizations where the mothers could continuously go do other things outside the center. When it comes from the university, it's very powerful. So think in those areas as well, but also their children, connect with their children as well. Because this is crime prevention in a smart way without mentioning crime. I tell you what, if we had gone to these women and said we are doing crime prevention, nobody would come. But because they are thinking that they will be empowered, so we keep the same language. You are now empowered, come on to Melbourne University. I'm suggesting something for you, Charlene. You need now to do leadership program so that these women can have a certificate from Melbourne University. You see, they'll never forget about it. So ask another funder to fund that one so that there is continuation. That's my answer.
You're the one that's good at getting money, Selba.
Charlene, my input into that is simply that with the new generation, how we really traveling between the university and grassroots organization, I highly really encourage that the universities to continue to do what they do at the core design with the grassroots organization, rather than being just coming to the independent researcher. So I can back it up. The beautiful thing about the Empower Mother project for design with the University of Melbourne, we get to catch up in a regular basis. So we know each other beyond just the research. So that's created a strong trust between the two partners, but as well also understand each individual, how they operated and the way they talk as well. So that's all take account to understand and to give the deep down. And the second point is that universities, if they haven't considered that, they need to start really empower small grant organizations like us with a significant a partnership that they can stick with us. We have a place where we can like an umbrella. We have the university of the place. The practitioners are here. And what that means that the researchers, so they get to see, we get to see them, they get to see us, our people get to see them, the people get to see our people. So I think that would be the new way for innovation, unless it's already have done yet. I hope this helped.
Thank you very much, Selba. Thank you very much, Mamadou. Charlene is very influential at the university, so we'll follow up on that. Thank you very much. Hey, Kofi, you've got a question.
Yes, please. Thank you very much to all the presenters. And I would just take you a little bit back to one of the questions, I think it was from Lona, and the question about replication of these projects across Victoria and probably Australia in general. Thank you, Selba and Mamadou, for your readiness to expand this. But I would also want to ask whether you could extend the Ubuntu in regards to mentoring young, newer groups, so that it's not only Mamadou and Selba that is replicating it, but rather newer groups that are also coming on board. You are having more hands on board to be able to reach out to many people. If we make it that the Ubuntu is widening to include so many hands, I think ultimately it is about empowering Africans, making Africans integrate well in Australian community. So if that is the ultimate goal, then the Ubuntu must extend to newer groups rather than it sitting with Mamadou and Selba. If you could comment on that for me, thank you.
I will comment. Sorry, Mamadou, you are a man. Women first, we are in Australia, I'm sorry.
Yes, true, right. Okay, we follow that, yeah. Okay.
Now, I understand your question. So the department gave us this money to come up with this, to co-design this Ubuntu concept model. I think the best way is to see what why am I running out of words? What the findings will be, right? And then put them into practice. I am African. It can be diluted because I tell you what, some people, if they don't know exactly what Mamadou and myself have been doing, sometimes it will not be delivered properly and people will start talking bad things about this program. So I would say, wait for the evaluation to come and maybe, I don't know what the department wants to do with it, and let's work it from there, and then people can learn with something that has been studied. I know Africans, we have got pull down syndrome. I'm not scared of talking about this because I know it happens. Because people will say, I want to try, they will be pulled down. But if it's backed by evidence-based, then it can be used appropriately. That's just my thinking. Groups can start and then come to the university to ask how has this been done? It's not wanting to own ownership of this, no, but it has to be done properly because people are suffering. I work on the ground daily, people are suffering. If we can do this properly, we are going to help many. That's my answer, Kofi.
Yeah, thank you very much.
Just a quick comment on that is, Kofi, thanks so much for saying that. I guess really the best, also another way really to do it, organization now who are really hearing about this, they should reach out to us. So we will be able to really form more formal partnership. So while we already been doing this and testing it and getting the evidence, I would encourage through the innovation practice. If I were an organization, I would consider, look, this is a new innovation, let me try. So we are here. We are ready to deliver. I just mentioned before, we went to Shepparton, voluntarily went to Shepparton to have this meeting. So this is to show how much we really want to give back to the communities and how much we really want to share our knowledge with others. So we don't want to keep it ourselves. It's not for myself or for others, it's for everybody. you remember, people must remember that people who work with, we are not related. We are just community practitioners like everyone else. If they're really appreciating it, then for me, that's a strong evidence. So if you got some people there, let them to talk to us. And then we will talk to them back. And then we see how things work, move forward.
Thank you.
Sorry, I just have this question for Selba and Mamadou. In terms of intake assessment, do you have a particular procedure that a mother have to go through, or you just any of them that is in need,
So for us, we have a focus group, and when we are doing storytelling, it assists us to then invite the woman to come and do a thorough assessment. We have got our own document, which is health and well-being assessment. It covers all the areas of a person's life. It's like walking in their shoes. And that's why you were able to see Dr. White, because the women were, Kofi saw Dr. White, because the women were able to open to see what their issues are. So there are some women, they just come here for the presentation, but those who have high needs, kids in jail, kids going through the court, they are looking for work, or we can actually see that their health is failing. Another thing that I forgot is we are actually assisting our community into NDIS. Now we are doing NDIS. So it's assessment based on the needs of the person. So the areas we choose, which one is first? Those who just want to come and enjoy Ubuntu, that's okay. So it's not every person that we do the thorough assessment. And when doing assessment, you just have to ask consent. If they don't want, it's oh, enjoy Ubuntu. But if they want, we are going to help them.
Okay, thank you.
Thanks, Patient. Actually, this question is really, really bad. If the panel doesn't mind, I would nominate Julius actually to answer this. We have really approach where we do our assessment. So Julius can say like 1 minute how it's all done at Afro end.
Yep. Go ahead, Jairus.
Hey guys.
Hi, Gerald.
Thank you for facilitating this conversation. It's been really interesting. My name is Gerald. I think Mamadou spoke about me before, and I'm the general manager of AAFRO, and I've been working closely with the Ubuntu in practice. And to answer your question, Patience, I think for us, it's when the initial assessment process is fairly simple. First, we normally would do once someone approach us or we've reached out to a particular person that think they can benefit from the program that we're offering or our services. We first have a what we call a first catch up where we would meet with a person, have a discussion, get to know the person, and then we move through bringing them into where we located. And that's when we do our first initial assessment. And like what Mamadou touched on before, really, this assessment that we've developed, it's fairly simple, but quite comprehensive in the sense that through our work, what we've realized in the past, that you have a lot of the people of African background, mainly our mothers, that would go to services and they get given an assessment or a form to fill out and they don't understand what the questions are being asked. And what we've been able to do with our assessments, really simplify it to 3 simple questions. And through those questions, it's done in a setting that's very inviting and comforting. And we go through that assessment. Very simple in the conversation, like, that one-on-one chat, just very casual. And then we start to break it down. And from that, you'll be able to pick up just about everything from finance, mental well-being, the support system, the connection to the community through 3 simple questions. And we found that to be very effective. And that being said, I think the group of the mothers that we have at AAFRO now, they're very diverse in terms of needs. So yeah, that's the approach that we take. I hope I've answered your question, Patience.
Yes, thank you.
Thanks, Gerald. I think there's only one comment for you, and probably that's all. Selba, we've got 3 minutes. If you can answer this from the chat. This from Elsa. Yeah, good to see you again, Elsa. Good work, Selba. Tell us the reason why you do what you do. What's your why?
It's because back in my country, I was the second lady cartographer, very powerful woman. I came here, couldn't speak fluent English. I worked in a hotel. Mental health crept in, family breakup. This and my daughter went in off the cracks. This is what African women are facing. If there is no one who can be strong for them, it means a lot of women will go through the pathway that I went, let alone is the innocent children who are born in this beautiful country, they will be overrepresented in the Victorian prisons or Australian prisons. And why I do it, I just love it. Most of the times I am here maybe up to 11 o'clock. It's a passion. I'm driven by passion. When I see people changing, I go on and on. I tell you what, when I was with my ex-husband, I looked 60 years old. Now I'm 57. You see? So, and that was about 7 years ago, 6 years ago. So when you have a passion that is actually changing, you have to follow that passion. And I have to thank the Victorian government. Honestly, they are listening because they are now doing grassroots work with us, understanding what is going on for people. So my sister, what drives me is the positive changes. We don't tick boxes. That's why we always invite people, come to Springville, see yourself. I have seen ministers inviting themselves coming here. Why? They want to see what we talk. So that's the reason. And also seeing the mothers being happy, it makes me very, very happy. I was depressed for a long time. So many years wanting to kill myself. Why I didn't die? Because I'm a Christian. I didn't want to end my life. How many people have died? I've said it in my presentation. If we can prevent this, if someone comes to me and said, I want to kill myself, you help them and you see them now, they are doing very well. You know what? I'll wait until when I'm 90. Thank you.
Thank you very much, Selba. Right on time. That is really, really good to hear from you. Can I thank our patients, Selba and Mamadou? Wonderful presentations. Apologies, I saw a few hands up. We might find some other time to get those questions done. So thank you very much, the audience, for attending this panel. I now hand you back to one of the organizers, JP. Thank you, guys.
Thank you very much, Gerald, for facilitating what everyone will agree with me. That was an impressive discussion. Thanks to Patience, Selba, and Mamadou for the presentation. Also, and I think I saw Julius as well. He spoke a little bit for the great work that you are doing for the community and the great impact you are doing for our people. And to the attendees as well, the audience, for your kind attention. So before we sort of break off, I would just make one sort of comment. We're coming back at 1:30, but the Zoom link will sort of change. So please be aware of that. So don't use this link. It's gonna be a different link. Check your email and please use that one. So I would like to officially adjourn this session, and I see you at 1:30 for the keynote lecture. Thank you very much.